percutaneous Topaz technique for a thickened Achilles tendon. This is a new technique. After introduction of intravenous sedation and local anesthesia, an S-mark bandage is utilized to exsanguate the foot. A calf tourniquet is then raised to create the hemostasis needed for the procedure. This patient has been suffering with chronic pain to the Achilles tendon and has had an MRI showing fusiform thickening and degenerative changes of the Achilles tendon. Prior to the procedure, the area of pain is mapped out utilizing clinical examination as well as MRI to help isolate the pathologic area. Utilizing a .062 K-wire, the holes that have been mapped out will be penetrated and percutaneous incisions will be created. These incisions will enable us to introduce the Topaz wand to create the surgical correction. The Topaz wand is then introduced through these percutaneous holes. The Topaz wand is taken to the level of the Achilles tendon and not penetrated until the pedal is stepped on, and then the wand is penetrated, releasing the Topaz frequency to stimulate the healing process. All holes are utilized throughout the procedure at different angles, penetrating the tendon. Through intraoperative X-ray, we can see first how the K-wire penetrates the skin but then does not penetrate the tendon. It stays superficial to the tendon. This is just used for demonstration purposes and is not necessary during the case. The Topaz wand is then introduced through the skin. Resistance is felt from the Achilles tendon. The pedal is stepped on, and the wand then penetrates into the tendon, as you can see here. Additional applications are then utilized deeply within the tendon. Once again, the wand is then introduced through a different hole, and a similar technique is performed. Post-operatively, the patient will have steri-strips applied to their wound and placed into a bulky compressive bandage and a walking boot for 2 weeks. The patient will be allowed to remove their bandages 5 days after surgery and allowed to return to bathing at that time. They will then return to guarded weight bearing with a gym shoe approximately 2 weeks after the procedure. We have found that this technique is superior and offers less post-operative discomfort than open procedures, and we've had excellent success with this technique.